In this video, we examine the effects of modified citrus pectin, MCP, against cancer. In the book Cancer Self-Defense 101, Quick Tips to Help You to Survive, MCP is listed in the Not Quite Ready for Prime Time section, meaning although it's promising, the human evidence doesn't quite rise to the level of the other supplements recommended. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Citrus pectin is a soluble fiber derived from the white pith of citrus fruit peels. Modified citrus pectin is pectin that has been modified through a pH and heat-controlled enzymatic process to yield a lower molecular weight product that can be better absorbed into the blood. MCP has been found to induce apoptosis, cancer cell death, by raising caspases 3 and 8. But its most important and unique mechanism of action is the inhibition of Galectin 3. Galectin 3 is an adhesion molecule that is closely linked with the spread of metastases. Galectin 3 levels are elevated in every cancer. In colon cancer, blood levels are, on average, increased 11.3-fold over normal. In colon cancer, patients with metastases, blood levels are increased 31-fold over normal. Elevated levels of Galectin 3 are also associated with worsened outcomes in several other diseases, including heart and kidney. In an animal experiment, MCP has been found to block the adhesion of Galectin 3 to the lining of blood vessels, how metastases start, by 95%. The same was found with actual circulating breast cancer cells. In another study, one group of rats received intravenous MCP and the other did not. Both groups were then injected with prostate cancer cells. The MCP group had a 50% rate of lung metastases, while the control group had a metastases rate of 93%. The MCP group also had an 89% reduction in the size of their metastases once they formed over the control group. In human experiments, MCP has been found to significantly reduce prostate-specific antigen doubling time in men with progressive prostate cancer. In 29 patients with a variety of advancing cancers, 5 grams of MCP 3 times a day produced an overall clinical benefit rate of 20.7% and a stable disease rate of 22.5%. One patient with metastatic prostate cancer showed a 50% decrease in PSA levels after 16 weeks of treatment, which was associated with a significant increase of clinical benefit, quality of life, and decrease in pain. Despite these promising results, and despite Galectin 3 being a factor in so many diseases, these are the only 2 human studies of MCP. MCP has also shown to synergize with multiple chemotherapies in cell line experiments, including cisplatin, staurosporine, etoposide, bortezomib, dexamethasone, and doxorubicin. This is primarily because Galectin 3 can dampen the effects of chemotherapy. The one negative about MCP is that it can interfere with the absorption of other medications, including statins. The lack of human trials compounds this problem because we simply don't know what kind of effect it would have on the bioavailability of other medications. Therefore, we consider MCP, even though it acts against cancer in a totally unique and powerful way, to be slightly higher risk than the other supplements recommended in other videos. There are definitely moments when we believe it is worthwhile, such as before and after surgery or chemotherapy, or if you feel you are at high risk for metastatic spread. If you do choose to take it, it may be good to try to space it out away from your other treatments time-wise. Again, questions that require a high degree of knowledge of your specific situation can only truly be answered by a qualified medical professional and yourself. The Pectisol brand is recommended over others as it is the one that has shown efficacy in human trials. For more information on modified cancer pectin, see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.